Hailey Bieber shocked the world when she suffered a mini stroke, or TIA, at just 25 years old. She recorded a YouTube video that is so educational and no doubt has had a ripple effect into the entire community. She's a true advocate for women and heart disease. Today, I sit down with Dr. Jonathan Tobis of UCLA. He helped save Hailey Bieber's life, and we're going to talk about strokes, PFOs, and young women. I hope you enjoy my conversation with Dr. Jonathan Tobis. I'm really interested in PFOs. Can you tell me more about what is a PFO?
Patent foramen ovale, or PFO, is a little flap in the heart that everybody is born with, and it's necessary to get the oxygenated blood from the mother's placenta across the chambers of the heart. If it went the normal pathway to the lungs and then to the left side of the body, there wouldn't be enough oxygen left. All mammals have a patent foramen ovale, and it prevents the oxygenated blood from the placenta to get across the chambers of the heart to go up to the baby's body and brain.
Can you tell me about the correlation between migraine headaches, PFOs, and strokes?
So this goes back 20, 30 years. Young people would have a stroke and of unknown cause. It was called cryptogenic stroke. And the more that we started doing echoes of the heart, and especially transesophageal echo, where you have to swallow a probe in the esophagus, we could now see this little flap, this PFO. And we realized that there were a lot of people with these strokes of unknown cause who had a PFO. About half of those people who had a stroke also told us that they had migraines, especially migraine with aura. And when we closed the flap to prevent a recurrent stroke, the patients would come back, and about 70% of them would tell us that their migraines were better. About 10% told us that their migraines were completely gone. And these are in people who had migraines ever since they were teenagers.
As a mother of 3 daughters who occasionally get headaches, what can you tell me about PFOs, migraines, and at what age should we be concerned about PFOs?
The PFO usually is not clinically evident. Patients don't have any symptoms, and so unfortunately the first episode may be a stroke. If there is a history of migraines, especially with aura, the visual changes that occur with the migraine, then it's much more likely about half of those people will have a PFO. The importance for young women is that if you are on birth control pills, the estrogen increases the risk of forming blood clots in the legs. And we believe that's where the blood clots come that pass up through the heart, go across the chambers of the heart through the PFO, and can wind up in the brain, causing that stroke of unknown cause. So it would be helpful, especially in women with migraines, to find out if they have a PFO. And those people who do have a PFO, I would recommend that they not be on birth control pills, that they find some other form of contraception.
How do you know if you're having a stroke?
The brain controls all of your neurologic functions. So a stroke can be manifested by any neurologic deficit. So it can be visual problems, loss of vision, sensory problems where you get numbness or tingling. It can be motor problems where you get weakness, can't move one arm or leg or side. So those are the major manifestations of stroke. It can be inability to speak, aphasia. So if that does happen, then you should get to a hospital right away, because nowadays there are ways of treating a stroke, especially within the first few hours. Most strokes are due to blood clots in the brain, and from multiple sources. PFO is only one of them. That blood clot can be treated. It can be dissolved with medicines, or it can be retrieved mechanically with a type of catheter that can remove the blood clot, permit blood flow to get to the brain, and can reverse the problems of stroke.
What age range have you seen in your patients?
It can be in the teenage years. More commonly, it's in the 20s and 30s, especially in those women who are on birth control pills. We also see it as people get older. The older we get, the more likely you are to have varicose veins. All women who have been pregnant have varicose veins, and that's where the blood clots come from.
Wait, you just mentioned teenagers. Could a teenager suffer a stroke?
Yes.
Wow.
Yes. It's less common, but certainly can happen.
Okay. What exactly is a migraine with aura? Can you explain it to us?
It can be difficult to distinguish in some cases a migraine with aura, especially what's called a complicated migraine, where you have neurologic deficits. So your vision can be affected. You may not have the ability to speak, aphasia. You may have weakness or numbness, just like you're having a stroke. But the symptoms pass with a complex migraine. The aura is due to what's called a spreading wave cortical depression, and it can be seen visually in an animal model of migraine. And there is an optical wave. You actually can see it or cover over the brain from the back of the brain, what's called the occipital area, up over to the sensory and motor areas of the brain. It takes about 20 minutes. And that's usually the time that an aura takes. So people with migraine with visual aura will often describe zigzag bright lines that go around in an arc and that they get bigger over time, over about 20 minutes. That's called fortification spectra, because the zigzag lines looked like a fort from the 16th century. The other common phenomena is called scintillating scotoma. So you'll look at an area and it'll just sort of be shimmering, maybe with some color in it or bright lights, but enough so that you can't focus through it. You can't read, can't watch television. People often describe a brain fog. Their mentation is just not as sharp.
So if I'm a mom watching this and my teenage daughter has migraine with aura, what advice do you have for me?
I think one of the concerns I have is that this whole field is not very well understood by a lot of people in medicine in general. People who have migraines, especially migraines with aura, that's sort of the clinical manifestation that a PFO pathway is likely to be present. So that's why I think there is an increased incidence of stroke in people who have migraine. There's an increased risk of stroke in people who take birth control pills. I think all of those strokes in birth control pills or with migraine are due to a PFO pathway. And it's just not looked for.
It's become very public that you helped Hailey Bieber. The video's on YouTube, and it's amazingly educational for many of us. Now, what can you tell us about Hailey Bieber and that experience?
Hailey is a marvelous person and very bright. Hailey always said that she wanted to be a doctor at one point. So I got together with the Society of Cardiac Angiography and Interventions and proposed that we give her an award for her public service by providing that information to everybody.
I love that. It's beautiful. Thanks for watching Heartquake Media. Make sure you check out our website and social media for more information on heart-healthy living. And remember, wellness starts with the heart.